So I'm going to use that. This is a white bee. I'm going to use this like a disinfectant cloth, right? In the actual test, you would have to rip open a cloth and you would have to clean your stethoscope with it, but I don't have any. So we're just going to use this. And then this is going to be my hand sanitizer. That thing on the wall that you squish down, you're going to have to put this quite a lot. So when you see me put this on, it's because you need to. Okay. This is the way that I do it. You're able to do it however you want. You can go back to the head. Remember, if you think you forgot something and you still have time, you can always go back to it to cover it. So let's say you go and you forget about saying that the nose is bilaterally patent, right? And you keep moving on. And then when you get to the osculation, you're like, oh, I didn't do the nose. When you're done, you can just be like, okay, and can you please hold the nose for me and breathe out? And you can go back to it. As long as you cover all the points, they will give it to you. You just have to do it in 20 minutes.
Are they going to let you know if you miss it? Are they going to let you know if you miss anything?
Like in the moment? No.
Okay.
No, they're just going to let you do your whole run through. That's why I'm saying, if let's say you have 5 minutes left and you're done with it, but you realize that maybe you missed the whisper test, right? Okay. For the ears. You can go back to it. Be like, you know what? Can I also have you cover one of your ears? As long as you covered it, you'll pass.
Okay.
So just make sure. I would follow the rubric. It's a lot easier, but if you forget just one thing, just go back to it. I'm sure they'll cover it. That's what Professor Haskett said. Okay, so to start. Oh, terminology is important, so let me know if you can't hear me well.
Okay.
Because you have to repeat certain things I say. I'll say them loudly. I'll talk to the thing. Anyway, okay. Knock, knock, knock.
Come in.
Hi, my name is Bianca. I'll be your nurse for today. Can you state your name and date of birth?
Hello, my name is Joe Nava. My date of birth is June 8th, 2001.
Can I take a look at your wristband? Looking at the wristband. I'm verifying 2 identifiers. Perfect. So I see here in your chart that you have no allergies. Is that correct?
Yes.
Okay. I'll be performing a head-to-chest assessment. It'll take about 15 to 20 minutes. Is that all right with you?
Yes, ma'am.
Okay. Now closing the door or the curtain in Chamberlain to give privacy. Okay. So has a tech come in and taken your vitals?
Yes.
Okay, perfect. So just to get started, I'm going to assess your pain. So what did you come in for today?
My wrist hurts. And
feel free to stop me if you have any questions.
Whenever I move it, it hurts.
Okay. So can you describe this pain for me?
It's a sharp pain, and I only feel it when I move my wrist like sideways.
Sideways? Okay. And can you tell me, on a scale of 0 to 10, what level is your pain at?
Like a 6.
Like a 6? Okay. And does this pain travel or spread?
No. It's just here on this part of the wrist.
On that part of the wrist? Okay. And is it a pain that comes and goes? Is it a constant pain, or is it...
No, it comes and goes. It only comes when I move my wrist like in a certain position.
And does anything make this pain better or worse?
When I don't move it, my wrist at all, I don't feel anything, so...
You don't feel anything?
Yeah, when I don't move my wrist.
Okay, perfect. So, by the end of this, hopefully we make you feel better. I'm going to put your bed at the highest position, just so it's easier for us to communicate. Perfect. So now I'm going to assess your levels of consciousness. Okay, is that all right with you?
Yes.
Perfect. So can you tell me who the president is?
Trump.
Can you tell me what year it is?
2026.
Can you tell me what you're in for? What you're here for?
Oh, for pain on my wrist.
Pain on your wrist. And can you tell me your name?
Joe Nava.
Okay. Patient is alert and oriented ×4. Looking at patient's physical appearance aligned with chronological age. Patient looks well kept. No signs of acute distress. Mood is fluent. Mood is relaxed, calm. Facial expression is calm. Speech is clear and coherent. No signs of acute distress. Important to know. Okay, so Now I'm going to be conducting that assessment that I told you about. Okay. Can I please take a look at your hand? Yeah. Okay. Taking a look at the hand, I'm seeing that skin is intact. I see no signs of bruising or lesions. Looking at the fingernails are round, pink, no signs of clubbing. I'm now going to perform a capillary refill. It should come back in 2 to 3 seconds, less than 3 seconds, whatever floats your boat. Perfect. I'm now going to check your radial pulse. So checking it on one, checking it on the other. And then can I have both hands, please? Perfect. Radial pulse is +2 bilateral because +2 is the pulse. Bilateral means 2 of them. So they're equally normal. Then you have, then I would put hand sanitizer again. And then this is when I start my actual assessment. So I don't have gloves, but I'm just going to pretend to put it. Like if you see me do this or go like this, it's because I'm taking off gloves.
Okay.
Here. Yeah, because I don't have any. Okay, putting on gloves. Okay, now looking at the head. I see no signs of infestations, no lesions, no bumps. I'm not going to touch your head, okay? I'm going to start palpating the head for any bumps or any lesions that I can feel. No bumps. Head is round, normal, cephalic. Moving on to the eyes. Looking at the eyes, I see no signs of redness, no discharge, no swelling, no lesions, nothing that I can make note of. Do you have any history of light sensitivity or epilepsy?
No.
No? Okay. I'm going to dim the lights. Okay. So I'm going to do a light test on you.
All right.
I'm going to have you look at my finger over here and over here. Okay. Pupils constrict. Pupils both constrict. Bilaterally constrict. Sclera is white. Can you pull down your eye for me? Conjunctiva is pink and moist. Eyes are equal in size and diameter, which is 3 to 5 millimeters. And eyes are symmetrical to face. Very important. Okay, so nose symmetrical to face. No signs of any lesions, abrasions. No signs of redness or discharge. Now I'm going to have you look up for me. No signs of drainage. Or discharge, whatever you'd like. So now I'm going to conduct the patent test. Can you hold your nostril for me? And breathe in and out. Can you hold your other nostril for me? Breathe in and out. Perfect. So nose is bilaterally patent. Now moving on to the ears. Looking at the ears, I see no signs of lesions or redness, any abrasions that I could note, no signs of infection. I'm going to look inside your ears. And can you look that way for me? Okay. No signs of redness or discharge. Ear canal is pearly gray, which means it's normal. Healthy, which means it's healthy. Pearly gray, which means it's healthy. No signs of redness or infection. I'm not going to conduct a whisper test on you. You're going to hold
I have a question.
Yeah, go ahead.
Okay, so do we have to say ear canal? It's not in the script, right?
No, I just stated because I align it with redness.
Okay, gotcha.
Because she wants you to look what my professor said. I'm not sure which one you have. What my professor said, maybe they grade differently. I look in the ear and she's like, I want you to know that it's pearly gray. I don't want you to know, I want you to know that there's no redness, there's no pink, because that means there's a sign of inflammation. So
yeah, but in the script, right, it's not bolded.
Then you probably don't have to for your professor.
You know what? I'm gonna just follow your script.
This is what I do. This is what works for me. That's what I'm saying. Take a video, copy what you want. This is just how I do it.
All right, gotcha. All right, keep going.
Ask your professor. Your professor's probably, a better grader. Mine is, I'm a little nervous, but it's okay. Anyway, Where was I? Ears. So can you hold down one of your ears for me? I'm going to perform the whisper test.
Okay.
I'm going to get behind you. I'm going to go on this. A, B, C.
A, B, C.
Hold your other ear for me. 1, 2, 3.
1, 2, 3.
Perfect. Ears are sound. Hearing is sound. I'm now going to move on to your mouth. Looking at the mouth, symmetrical to face. No signs of dehydration. Lips are pink and moist. Can you open your mouth for me? Looking at the teeth, no signs of dental issues. Tongue, pink and moist. Buccal, pink and moist. This is where I'm going to use my tongue blade. I would take it out of the wrapping. Okay, can you say ah for me? Okay, perfect. I would discard. Uvula is pink and moist. Tonsils are pink and moist. Everything in the mouth is pink and moist except the teeth. Can you pull down your lip for me? Gums are pink and moist. No signs of redness or inflammation. Perfect. So now I'm going to discard my gloves because I touched the mouth. So it would be yucky. That's how I remember it. Then I wash. Right, disinfect my hands. Okay, I'm now going to be moving on to your neck, and then I'll perform the osculation, okay?
All right.
Putting on gloves again. Okay, so looking at the neck, I see no signs of lumps or any bumps that I can see. I'm now going to palpate your trachea. Can you look up for me? Trachea is midline to body. Feeling for any lumps. No bumps of any kind. I'm now going to feel the carotid pulse. And you do it one at a time. You don't want to do it at the same time because obviously that blocks blood flow to the brain. It happened in my class, so that's why I'm letting you guys know. Carotid pulse is +2 bilateral because +2 normal. Then we are going to feel for the lymph nodes. Lymph nodes should be non-palpable. If it's palpable, there could be a sign of infection. I forgot something. I'm going to go back to it. Palpating the external meatus of the ear. Ear should be non-tender. Okay. I have to take off my gloves because I didn't do anything with your mouth. Now I'm going to osculate your lungs. Every time that I go from side to side, I want you to take a deep breath for me, okay?
Okay.
Okay, I'm going to pull it up. Go closer so you can see exactly where I put it. Okay. So remember to take a deep breath each time I go side to side. It needs to be a side-to-side motion. My left, your right.
Oh, it is.
Sternal. First upper right, first upper left. Second upper right, second upper left. Third middle right, third upper left. Fourth lower right, fourth lower left. 5 lower right, 5 lower left. So if you see for the front, it's really easy. You just stay in the middle, right? And then you just follow like the pectoral muscles. It's the same thing in the back. You don't want to go all the way down because obviously your lungs don't go all the way down. You need to follow the pectoral. So it's kind of like a J. You go a J on each side. And then for the back.
Oh, by the way, do you gotta say lobe?
First upper lobe, yeah. I say
Okay.
it because you have to know that it's a lobe. It's not just first upper right, second upper right. I mean, ask your instructor.
Okay.
I don't know. My instructor told me no. My instructor was like, I want lobe. And I was like, okay. Because we asked her that. I was like, oh, it's so easy. First upper right, second upper right. She told me no. Ask your instructor. I'm not sure. Maybe
who's your instructor?
Okay. Sorry?
Who is your instructor?
Mine is Haskett.
You got the same person.
I have Davis too. I did Davis, but they kind of don't agree on everything, and Haskett is going to be the one that I think is judging me. Davis said that he's not going to be in my class, so I'm like a little nervous for that because she's a little harsher, I'm not going to lie. Anyway, so we have left. So it's first upper left. Sorry, it would stay in the middle. because here your scapula is, right? So you can't hear anything here. So it has to be straight down the middle, and then the same thing, it's going to be a J. You just have to follow the scapula, and it's going to be a J. So first upper left, first upper right, sorry. Second upper left, second upper right. Third upper left, third upper right. Fourth lower left, fourth lower right. Fifth lower left, fifth lower right. Sixth lower left, sixth lower right. Seven lower left, seven lower right. Eight lower left, eight lower right, because 8 goes diagonally. And then 9 lower left, which is under 8, 9 lower right. So here at the end, it kind of goes like here, and then you hear here, and then down. Because your lungs, you can hear them on the side as well. So try to keep that in mind. Okay, lungs are clear, no sign of drainage. They are bilaterally clear. Can you breathe fine? Do you feel like you're out of breath?
No.
No, perfect. I see no signs of accessory muscle use. No signs of straining. Usually when a person is hyperventilating, that's a sign of accessory muscle use. That's in bold in the thing, so I just stated. Perfect. So now I'm going to move on to your heart. I'm going to go into the diaphragm for higher sounds, and I'm going to go in with the bell for lower sounds, okay?
Okay.
So, aortic pulse in the second intercostal space in the right sternal border. Pulmonic pulse in the second intercostal space in the left sternal border. Erb's point in the third intercostal space in the lower left sternal border. Tricuspid in the tricuspid pulse in the fifth intercostal space in the left sternal border. And mitral in the fifth intercostal space in the mid-clavicular line. I would hear for the apical pulse here for 1 minute. My professor doesn't make me do it though. Going in again with the bell. Aortic, pulmonic, tricuspid. Tricuspid, try to think of the nipple line and try to go horizontally. So tricuspid is always going to be right here. So think about what the nipple is. Go to the middle of the chest and the left side, and that would be where the tricuspid is.
Okay, when you're doing with the bell.
That would be where Erb's point is. Tricuspid would be right here. And then mitral, try to, again, think of the nipple line, but vertically now. It would be right under that, in the fifth intercostal space, the same as tricuspid. I wouldn't listen to the apical pulse here with the bell. Okay. Heart is strong and rhythmic.
Bianca?
Yeah?
So, when you're listening for the bell, you wouldn't say the location again, or?
No. Davis told me no, same thing as Haskett. They were like, nah. Like, if you said it once, you already know it. Like, just aortic, pulmonic, Erb's, tricuspid, and mitral. As long as you say it first with the lungs.
Okay, that one I probably have to ask my professor again. Because I'm not sure if she told us to say it or not.
Okay. For the aortic, the first time around with the diaphragm, yeah, I have to say intercostal, left, right, whatever. But for the bell, no, you just say aortic, pulmonic.
Okay. Okay, because I feel like that would speed up the process more.
Yeah, I mean, of course. I mean, they just need you to verbally say it once so they know that you know. You know what I mean? But, like, after you say it, they're like, okay, like, she knows it. She's obviously not going to repeat it with the bell. Like, she's just going to say the same thing over again.
Okay, thank you.
Yeah, no problem. I asked that question, too. I was like, bro, do we have to say it again? Okay. So I took off my gloves. I'm now putting on hand sanitizer. I'm going to clean my stethoscope. Okay, thank you so much for allowing me to do that assessment on you. Can I reassess your pain on a scale of 0 to 10? Can you tell me where your pain level is at?
Yeah, it's like a 6, but only when I move this. Only when I move my wrist.
It's like a 6, but only when you move? Okay, perfect. So I'll let your provider know. Is there anything else that you may need from me?
No, I'm okay.
You're okay? Okay. Lowering the bed to the lowest position. I'm going to lower this bed just so you can get out of bed easier, okay?
Okay.
Perfect. If both rails on the head are up, there's nothing that you need to do anymore. But if only one rail is up and all the other ones are down, you need to put another rail up. So putting the rails up on the bed and making sure to lock the bed. Okay, perfect. I'll come back. Do you want water?
No, I'm okay.
Okay. I'll come back with some plans on your pain.
Okay.
Make sure to wash your hands before you leave the room. Boom. Done.
And then you would also give the patient the call light, correct?
Sorry, I haven't done it in like 2 days. I've been studying for passive. Here. You would give it to them in their hand. So I did the mistake of leaving it like by their bedside. Like, let's say their hands are like this. I leave it kind of like to the side of the bed. Davis told me to literally grab their hand and be like, here you go. This is the call light. You can call me if you need anything. So I don't know if your professors told you that, but I have to do that.
Okay.
Okay.
I mean, that makes more sense, though. Yeah.
Yeah, that would make more sense. Some people aren't able to, move. I don't think I missed anything. I also don't have my paper on me, so you guys let me know if I missed anything.
No, I think you covered everything.
The Turger test.
Oh, I knew it. I was like, I finished the hand. I was like, I finished too fast. You would ask the patient, just treat them like a normal patient. You would ask the patient, like, oh, I'm not going to perform this Turger test. You might feel a light pinch. He's like, as long as you vocalize to the patient, because you just have to treat the patient like they're scared, like they don't know anything. If you let them know, like they kind of expect it,
Yeah.
That's all she told me.
And in the script, for mouth part, you'll be looking at lips, gums, and tongue, right? Those are the only 3 bullet parts.
Yeah, I do everything. Even with that, I would still pass. Like I missed the skin trigger and which other one? The call light, right? I missed 2. I still pass. Like it's not hard to pass, honestly.
Wait, really?
Obviously, don't shoot. Yeah, you don't have to get.
Our professor said if we miss one of the bolded points, we fail.
Who's your professor? Wow.
Her name is Professor Maple.
Oof, girl. I think I covered most of them except the call light and the skin trigger. Those are all bolded. I did everything. The only thing I missed towards the end on these last 2 exams were the hip. Raising at the hip, the first one. That's the only one that I missed on this last practice.
Oh
I even covered bullet points like buckle. I said buckle. You can ask Sebastian. That's not even a bolded thing on there. And I say it just because I'm scared. I'm so scared. Dude, I practice like crazy. I practice on my mom like 10 times. Bro,